Okay, so I'm going to be going through the technique that is hand expressing, and remember you can use this for all different reasons. It's a really valuable technique to know. So I'm going to go through it. Right, just let me get my breast out. Ta-da! Here's what I got earlier. So now what we need to do, what's really important, is get your sterile container ready. Okay, so it could be anything that you've sterile, but it could be something like this, or if you're in hospital you may be given one of these, okay, which is a sterile syringe. So just ask somebody to go through this with you, and you might need a little bit of help. First of all, if we're expressing colostrum into the syringe. Okay, now what's really important as well is that we prepare the breast ready to be hand expressing. We need to be stimulating all the hormones to start releasing the milk. Okay, so by generally massaging the breast like so, stimulating the nipple with the palm of your hand, yeah, tapping around the areola, a good 5-minute massage will really stimulate and encourage that milk to the forefront of the breast. Okay, now what we actually have are milk ducts all around here. Okay, when you press down they feel like little pea-like ducts is what they are. Now what the idea is that we actually squeeze the milk ducts together for the milk to come out the end of the nipple. We're not squeezing the nipple to get the milk out. The nipple is just an exit for the milk. So it's really important that we squeeze these milk ducts together. Now the easiest way to be able to do this is to get your fingers in a C shape like so, okay, and always ensure that the C is above and below the nipple, okay, and it's usually about 1 inch above and below. Okay, can you see there? Now because what we're going to be able to do there is squeeze the milk ducts together. If our fingers are over here, okay, we're just going to be squeezing breast tissue and we won't be able to be getting the milk out. So just make sure your fingers are in a C shape above and below the nipple, okay, and then what we want to do is compress into the breast. Now it's in quite a firm motion, okay, and we got compress, okay, and release, compress and release. Now sometimes this can take a bit of patience, all right, it can take a couple of minutes for the milk to start flowing, okay, but you just carry on by your fingers in a C shape above and below that nipple, about 1 inch, and then you compress into the breast, almost in a backwards motion as well, and as I say, quite firm, but you don't want to be hurting you in any way, shape or form, okay. So compress and release, all right. Now what you may find is that the milk will start flowing, but then it will start slowing down again. But again, this is just completely normal. So if you find that the milk is starting to slow down, you just can turn your fingers like so, and you can be squeezing other milk ducts, okay. There we go. So remember, you can use this technique if you're harvesting colostrum antenatally, or if you are choosing to just give those first few feeds, if you're formula feeding, by relieving engorgement in the breast, you know, for a baby to latch on properly, you know, being out and about and you need relief on that breast, hand expressing is really useful. So remember as well, you can either watch this video again, or once you are in hospital, you may need to just ask your healthcare professional to go through with it with you again, okay? But thanks for watching. See you later.